Hi everyone, this is Leanne. This is From the Heart. This podcast is entirely dedicated to the increase in maternal death that we have been seeing over the last few years. There is a new document that came out from the SOGC in June of 2026, and it says that the increase in maternal death has been happening for 30 years. Now, I cannot say that I have been looking at the maternal death rates for 30 years because 30 years ago I was 8. But I have been looking since I was 18. And the increase, the number that was there when I was 18 was 6. It was 6 per 100,000. And then when I look at what they say right now, it is 6 per 100,000 in what they're saying in the 90s. So, like, honestly, I have a lot of concerns around what the SOGC is saying. Why did it take 30 years for us to do anything about the increase in maternal death rates? 30 years. That's like, I was a teeny tiny little child. Like, why did we wait a whole new generation? Let's just keep, how high can you go? You know, like, why? How did that happen? It's true that in 2021, it was at 9 per 100,000. Then in 2022, it was 11. It's continued to increase in 23, and it is now at 12 in 24. And in case you don't know, the Stats Canada is very inaccurate. So for us to see any sort of increase, it means that there's a very big increase for us to even see a minute increase, because there are only 3 provinces that take in the data. Excuse me. And the data is the data that we take in Ontario, which is pretty good, is only based on admissions. It's not based on what happens in pregnancy, and it's not based on what happens in the postpartum, except for midwifery clients. But midwifery clients only make up 8% of the population. So it's like, you can see it's really inaccurate. And maternal death is defined. It can happen in the pregnancy without her getting any care, and it can also happen outside of care in the postpartum. And it can also happen because of non-obstetrical reasons. And what I'm speaking of is obstetrical reasons, because that's my knowledge. I'm not a social worker. But we all see with our eyeballs, and we know with our hearts, that there's also been, an increase in deaths that would be related to social work, right? Like the increase in homelessness and drug use, violence, suicide, homicide, and all those things. So I'm not speaking of those because that's not in my scope of practice, but they are important things to discuss and for us to see. And so we do have to mention them, but that's not my knowledge base. So, oh yeah, and the other thing that I will repeat saying is that the Born database in 2023 had, based on admission, the data that they have based on admission was 17.5 per 100,000. So there's been a very, very big increase. Okay, things I want to note. Before May of 2026, before we were looking at any data, I've been saying for a long time, we need transparency. Because before May of 2026, we were blaming it on women. We were saying that the increase in maternal death is because women are obese and old. And now we are actually looking at data, we are seeing the opposite. We are seeing now that it is women who are young who have an increased chance in dying. The people between the ages of 20 to 25 have the increased rates. So it really shows how important it is for us to have transparency. We were blaming women 2 months ago. Okay, now we are realizing, because we are seeing the numbers, and the numbers are people, we are seeing that the effects of the lockdowns that we had, that these people who are 20 years old having babies now, and there's no problem being 20-year-old and having a baby. I know that lots of people judge young people for having babies, and I am not one of them, because I actually like the ones that were in my care, they were more mature than the older ones. But what we see today is that the impacts that we had from the lockdown, those were people were teenagers back then, and the impacts from that are devastating and are now impeding. They are affecting maternal death rates. And like I have been saying the entire time, pregnancy is a state of health. Everything else in the illness care system is illness. Pregnancy is not illness. It is the state of not just health, but of double life, maybe even more. Okay? So, and then we always say that having babies at a younger age is healthier. So then you've got double, triple, whatever. Like, it's just like, we need to start taking accountability. We live in a democracy. We know there's like too much data. You can call me a conspiracy theorist, but I want you to show me the data that that quality relating is what impacts our health the most. Quality related community, people support is what increases our health, our longevity, our quality of life. Okay, and then we shut that down for 3 years and made people afraid of one another, and people are still afraid of one another. And that's going to be continuing on for hopefully not too long, but realistically, we live in a democracy. We are all co-creators of this. Okay. Another thing I want to say is the SOGC and some other associations, they write the guidelines that we have to follow, and we have to recommend these things to our clients, because if we don't and we get caught, we could get sued, in trouble, removal of our privileges, removal of our license if we don't do it. Now, the SOGC apparently has said now that the increase in maternal death rates has been increasing for 30 years, and nobody has been saying anything until May of 2026. Do we really want them to be the ones writing the guidelines about what we recommend to our clients? And all the other associations are mute on this. Let's not talk about it. It's not important. Okay? Silence is not violence in this instance. It's also murder. Yeah. It's murder. So we have a lot to think about. We have a lot to absorb. And like I have been saying, the recommendations that I have seen in the last decade, I have not been able to see the evidence for these things. We have increased the amount of monitoring that we do for babies. Where's the evidence? The evidence shows that there's more intervention when we do that, which affects mom and babies negatively. Yet we still do it. We have increased the amount of induction for when there's no problem, right? We have increased induction for maternal age, for obesity, for IVF, for being of color. Don't ask me what I think of that one. That's an entire podcast that would last a whole year. Okay. Etc. Like I could go on. There are some things that have changed in the last decade that I understand the theory around. So I understand the theory around taking the woman's pulse when we're taking her baby's heart rate. I understand the theory. I would really love us to be able to look at the outcomes. So like we have the intention that we don't want to mix up the maternal pulse with the baby's pulse. but I would like to see the outcome on the population, which is nice to see. I don't expect that anything would be wrong with that one, but I would like to see. The other thing is like the SOGs, the other things that I can remember would be that the SOGC, the guidelines around the vaginal breech birth have changed a little bit. They came out in 2019. And when it comes to the baby's size, we have increased the size of inclusion. So instead of 2,500 grams estimated fetal weight, it is now 2,800 grams. And I understand the theory on that one. I would like to see the outcomes. I just want to see, what do we know? It's too bad that we don't offer vaginal breech birth for the vast majority of women, which is, in my opinion, not good care. I say it that way. I believe that women should be offered the truth about all their options. They have 3 options when their babies are presenting breech, and if we can't turn them, if they don't want to be turned, if we've tried once or twice and it hasn't happened, if we're calling ourselves baby catchers, we should be catching all sorts of babies, right? We should be telling women the truth. We should be using our skills appropriately, and we should be gaining skills appropriately. Okay, what else can I think about the changes that have happened in the last decade? Diabetes is problematic, the way that we treat it, the way that we diagnose this. In my opinion, I'm concerned. I would love to see the data so that maybe I would remove my concern. Maybe we could actually pay attention to something that's going on. So the reason why maternal death is increasing is because morbidity is increasing. So at any point that we are looking at and saying, let's decrease morbidity, we are reducing mortality. What's the other thing I wanted to say? Morbidity. Yeah. So the things I'm going to continue saying, recommendations, we need more transparency. Like, we need to have this data. This data is publicly funded. It belongs to us. I don't want to know the personal detail of certain women. No, that's not what I'm saying. Okay. I want to know, I want to see the numbers, which are people. Okay, I want to see that. I don't want to see the names of the people. That needs to be clear to all of us. We need to see the rise in C-section, the rise in induction. We need to see if what we have been, the reason why, the intention behind these things has actually helped us with those things. We also need to look at not just the benefits of these things, but the risks of these things. Have those increased as well? We need to look at all of that. I want to see the impact. Like, it's not just about intention, it's about impact. And look at the impact that we've been having. This is serious. This is not a joke. And silence makes it a joke. Yeah. I feel a lot better having quit my job. I will say that. I feel a lot better having quit my job. It's true, I don't make nearly as much money. I don't. But I feel a lot better in my heart. Women deserve a lot more. Yep. And we're not destitute. Like, we are the co-creators of all of this. When is it going to be enough for us to say enough? What number is it that you want on the board before we say that's enough? I truly believe that I truly believe that if we were to be honest with our clients and we had really good education with them that is pro and con, and we give them lots of information. I know that the system does not allow, especially physicians, to give a lot of time to clients. Okay, that's a reality. However, James, what's his name? No, Maxwell. James Maxwell has lots of answers to that. I believe that we can have really honest discussions about the benefits and the risks of things with people, rather than a push. We need to do this. There's a recommendation that this is it, black and white. This is it. No, we say there's an option. Recommendations are options. The recommendation is this. Option is this. These are the pros. These are the cons. You have all these other options. You can decline. You can push back. You can think about it. I really do believe that if we were to properly inform people and we were to look at evidence in a way where we had our skeptical glasses on, skepticism is very good and healthy, because what we are seeing in the randomized controlled trials is not what we are seeing in the population. And we need to start bringing that to our face, right to our nose, put on the skeptical glasses on, okay? So we have a lot to work to do, and it doesn't mean that, no, I want you to think about, if we're going to continue being silent, what is the outcome going to be? Are we going to wait until my little 3-year-old niece, Miley, is 30 years old before we start doing and saying anything again? Or are we going to start doing something right now? Okay, what number do we want on the board? Okay, those numbers are people. I keep saying that. There's laws that have to change. There's transparency that has to happen, because when we have transparency, we actually see, like you can see, we were blaming women before, and now we are seeing that the impact of what we've done has been affecting people's lives. It's huge. That's a very good improvement over the last 2 months. It's very good improvement. It's good awareness. And awareness is 90% of the work. It's hard to digest, yes. But how hard do you want it to be digestible? Do you want to wait 5 years? How hard is it going to be then? Okay. Now, for me, it was quitting my job. But just in case I pissed people off, you don't have to quit your job, but you do have to do things differently.